Mr. President?
Senator from Pennsylvania.
Mr. President, I'd ask that the quorum call be vitiated.
Without objection.
Thank you, Mr. President. I rise tonight to talk about a couple of issues I know that we'll be considering, at least I hope all will be considered in the negotiations that are underway. I know later in this hour we'll be joined by three of my colleagues, Senator Whitehouse, Senator Blumenthal, and Senator Duckworth. Each of us will be talking about these issues from a different perspective, but all focused on those in our society who are most at risk in the midst of this worldwide pandemic, in the midst of this economic and jobs crisis that we're confronting right now. We know that this is the most difficult public health crisis in a century, and one of, if not in the top two job crises we've ever faced. And when we talk about Americans who are most at risk, among them are, of course, older Americans. Tonight I'll spend some time talking about older Americans in nursing homes who are at risk if we don't take action. People with disabilities who need the benefit of, as do many older Americans, need the benefit of home and community-based services. Third, Americans who are in communities of color who need the benefit of Medicaid, among other programs that we should be focused on. Let me start with nursing homes. We know that in the context of nursing homes, the care that's provided there is the highest level of care for an older American or sometimes a person with a disability, and that's skilled care. We also know that that's care that's provided to men and women who have done so much for the country. Americans who have fought our wars, worked in our factories, built the middle class, built America in so many ways and gave us life and love. And all that they ask and all that their families ask is when they're in a long-term care facility, especially a nursing home, and that they're receiving skilled care, that it's quality care, and that in the midst of this crisis, that we're taking every step possible to protect them from the virus and to keep them safe. Unfortunately, that hasn't happened in America today. As we speak tonight, more than, and just a couple of days ago, the number was lower than this, but now it's more than 62,000 Americans have died in long-term care settings, most of those in nursing homes. When you add up the residents who have died, contracted the virus and died, with the workers who have died, more than 62,000 Americans. That's about 40% of all the deaths in America. We have to take steps to get those numbers down, both the death number as well as the case number. And of course, the two are directly related. A number of months ago now, Senator Whitehouse and I, and he joins us on the floor tonight, introduced Senate Bill 3768, which was the Nursing Home Protection and Prevention Act, which was a $20 billion proposed $20 billion investment in best practices. The tragedy here is that we know what works to get the death number down in nursing homes. We know exactly what works. And those nursing homes that were implementing these best practices months ago, way back sometimes in early March or even in February, are the ones who had lower numbers, fortunately, of deaths and case numbers. We know that you have to invest in a series of best practices. That means having enough personal protective equipment for everyone in a nursing home, but especially the residents and workers. We know that that is essential to keeping people safe. We know that testing is part of that, of course, and having the capacity to test frequently, and to have results transmitted very quickly. We know that cohorting, and it's not a term that we hear a lot about, but it's a very simple concept. Cohorting means you separate the residents with COVID-19 from those that don't have it. And as easy as that is to say, it is more difficult to institute in a nursing home. Sometimes you have to retrofit. Sometimes you have to take other steps that funding is needed for. But cohorting works. It stands to reason, but we know it works now that we have some experience with the virus. We know that surge teams are critically important as well as part of these best practices. If you have an outbreak in a nursing home, we've had so many examples of that in my home state of Pennsylvania and so many other states. When that happens, when the virus is spreading and there's a crisis in that nursing home because of the virus, you might need more help. You may need more doctors or nurses or certified nurses assistants or so many other critical personnel in that nursing home. So $20 billion is a good down payment on protecting Americans in nursing homes. So our bill would do that, and I'm grateful for the help of Senator Whitehouse as well as so many other members of the Senate who joined in that bill. Unfortunately, the bill proposed, I guess it was July 27th, some of the last days of July, the bill proposed by the majority has no meaningful investment in these best practices. And we have to ask ourselves, I guess, is this what America is going to settle for? The greatest country in the history of the world is just going to throw up our hands and say there's really nothing we can do. It's a pernicious virus, and the virus is spreading in settings, in congregate care settings like nursing homes, and you have individuals who are particularly vulnerable, so there's not much we can do. That is a defeatist, anti-American attitude. We know we can get these numbers down if we make the investment. The America that we claim to be would have a full-court press, a pull-out all the stops effort to make sure that we get these numbers down. So I don't think most Americans believe that we should throw up our hands and surrender to another 62,000 plus deaths a couple of months from now, which is where we could be headed if we don't take these steps. Now, no one would assert that we can get these numbers down to zero, or there's some magic wand that will allow us to remove this threat from those we love so much in these nursing homes. But my God, in America, we're not going to take steps that we know will work to get the case number down and the death number down. I think America's ready for an action plan that has been developed here in the United States by smart people who know how to attack this problem. So that's issue number one among the most at-risk Americans. Second, in terms of at-risk Americans, older Americans and people with disabilities, they need the benefit of home and community-based services. Again, the Republican bill proposed by the majority here in the Senate doesn't mention Medicaid. In order to attack the nursing home issue, the nursing home death problem, or to invest in home and community-based services, we need to invest in Medicaid. We must stabilize and strengthen home and community-based services to keep older adults and people with disabilities both safe and healthy. And to do that, you have to pay the workers more. The workers should be paid a living wage, and those workers, when they're going into a home to provide that critical care, should be provided the personal protective equipment that they need to keep themselves safe, but also that person with a disability or a senior needs if someone's coming into their home. Without sufficient dollars, human service organizations cannot recruit and retain the direct service, or I should say the direct support professionals and personal care attendants who provide essential healthcare and community inclusion services for seniors and people with disabilities. Just one example among many of a picture, an enlarged picture of Marissa. She's from Allegheny County, Pennsylvania. And you can see by the picture, and you may not be able to see it from a distance, but on the t-shirt she has is "Proud to be your neighbor," and you can barely read the word "giant eagle." That's one of the great supermarket chains in southwestern Pennsylvania. But Marissa uses home and community-based services to live independently. She's a volunteer at a food pantry, and as I said, she works at one of the Giant Eagle grocery stores, and she's done that work for 19 years. All these years later, she is one of the beneficiaries of this program where she can get services in the home and in her community. The key to this is without dedicated dollars, agencies like Achieva, one of the many agencies that does this work, that provides such services, these agencies will not be able to provide services that people with disabilities like Marissa and families like hers need. Pennsylvania, like many states, has so-called Centers for Independent Living. They told me just last week in a phone call that helping people move from a nursing home or a congregate care setting, where often the risk is higher with the virus, moving people from that setting who want to go into a home or an apartment, often their ability to move those people is fully dependent upon the dollars that they have, the funding that they have. They've been able to move some people, but very, very few, because they don't have the funding to move them. Another implication of this concern we have is that direct service providers have scaled back these services. Most don't have enough cash reserve for longer than a month. Just imagine that, because of the lack of funding. Now, I introduced a bill 4 months ago, Senate Bill 3544, which provided dedicated dollars to respond, but it wasn't until the HEROES Act passed by the House, not yet passed by the Senate, but passed by the House 10 weeks ago, included provisions of my bill, which was supported here in the Senate by 27 senators. Mr. President, I have just 2 more issues. One is Medicaid, and the other I'll address is on the liability debate. Medicaid, of course, we know what that program is. It's been around since 1965. Medicaid is the program that helps 75 million Americans. If you add up the children in Medicaid, about 31 million children, people with disabilities, another 9 million, you have roughly 40 of the 75 million. So Medicaid is not just a program, it's a program that saves lives, maybe ever more so in the middle of a public health emergency that we've been in all these months. Medicaid's also, I believe, a reflection of who we are as a nation. It reflects, I think, as well, whom we value. And that's why Medicaid is so critical to seniors living in nursing homes, sometimes from relatively middle-class families who could not afford long-term care. So many Americans with disabilities, as I mentioned, 9 million at last count, and of course, 31 million children, many of them in rural Pennsylvania, rural America. In fact, if you look at it by percentage, it's often the case that in rural counties, there's a higher percentage of children on Medicaid in the Children's Health Insurance Program, a higher percentage in a rural county than children in a county that has a lot of urban communities in it. So rural and small town America depends heavily upon Medicaid. It depends upon Medicaid in another way when you consider rural hospitals. Often the largest employer in a rural county in Pennsylvania or the second or third largest employer at least, is a rural hospital. We've got 48 of our 67 counties that are rural, and in those 48 rural counties, more than half, the top employer in the county is a hospital, or I should say the top or the second or third highest employer. So in the top 3 employers in most rural counties, you've got a hospital, and Medicaid is so vital to those rural hospitals, operating on thin margins and ever more stressed in a pandemic. Medicaid expansion, of course, made it possible for millions of Americans to get health care through the Affordable Care Act. And now, we just saw yesterday in the state of Missouri, the vote there to expand Medicaid, and it's been happening in a lot of states that may not have embraced Medicaid expansion a number of years ago, now embracing it. Medicaid is a safety net in this time of crisis in terms of the economic and jobs crisis we're living through. It, of course, impacts state budgets. One of the biggest expenditures in state budgets is Medicaid, and when people lose their job, for example, in our state, we've got our unemployment rate in June was 13%, 821,000 people out of work in Pennsylvania. In some counties, the unemployment rate is 14% or 15% or 16% or 17%. So when 821,000 people are out of work in a state, a lot of them have lost their health care, and they turn to Medicaid. Now, in the Families First bill, way back in the early part of March, the matching dollars, the so-called FMAP, the federal matching dollars for Medicaid, was increased by 6.2%. That was a good step in the right direction. But governors in blue and red states will tell you now, as will a lot of other people will tell you now, they need an additional increase in Medicaid. I think the 14% FMAP, or matching dollar percentage, in the HEROES Act in the House made a lot of sense. I hope we can get to that number in the bill that we're considering, or we hope to be considering soon. The Republican bill does not have additional dollars for Medicaid, matching dollars, despite the fact a lot of Republican governors around the country have asked for this kind of help. So I hope that will change as the negotiations move forward. Finally, Mr. President, let me end. I want to end on time if I can, maybe the next 10 minutes, that's the goal. I want to talk about the liability shield issue. There are a lot of different perspectives on this, but let me talk about it in the context of those we're discussing tonight. Seniors in nursing homes, people with disabilities who need home and community-based services, folks who are in communities of color, and others who need the benefit of Medicaid. The Republican proposal, in my judgment, when you look at the liability proposal, would slam the doors of justice to those who want to bring in action. We know that we've had a lot of commentary lately on our criminal justice system and the defects, the shortcomings, even the racism that I believe that permeates that system. In this context, we're talking about the civil justice system. What do we do about that part of our justice system? The ability for a citizen to bring an action in a court of law to deal with an injury of some kind, either by way of negligence or intentional conduct. But in this context, we have a proposal by the majority to short circuit, to undermine that system of justice. It will affect those we're here to talk about tonight in very real ways, whether they're low-income workers or people with disabilities or older adults, or even just more broadly, essential workers. Well, why do I say that? Well, because if you're going to use a crisis like we're in now to try to achieve gains that some in this chamber have tried to achieve for years in the so-called tort system, really the civil justice system, and you paint with a very broad brush, you're going to slam those doors of justice pretty tightly. Just by way of a comment from a law professor, Georgetown law professor David Vladeck recently explained in reference to this proposal that, and he using his words here, the, quote, extreme reach, unquote, of the proposal vastly exceeds, quote, any prior so-called tort reform bill that has been introduced in Congress, unquote. He went on to call this corporate liability shield provision, quote, essentially impenetrable. That's how he described the strength of this shield, and warned that such proposals would give, quote, license for irresponsible and reckless conduct, unquote. The bill, when it comes to liability, would also preempt all state laws requiring businesses to act reasonably. It would impose a heightened, so-called clear and convincing burden of proof on plaintiffs instead of the typical preponderance of the evidence standard. We know that in our system, in a civil case, the preponderance of the evidence standard is the lowest standard. Just a little more than 50% the jury would have to determine in terms of liability. We know that under the criminal system, in order to find guilt, it has to be found beyond a reasonable doubt. That's the highest standard. There are some cases that are given the middle standard of so-called clear and convincing. So that burden of proof is right in the middle. What this bill would do would be to elevate in a civil lawsuit, elevate it from preponderance to clear and convincing, which would be, I think, a step in the wrong direction. The proposal would also force a worker, a consumer, a resident of a nursing home, or even a patient to show that a business failed to make, quote, reasonable efforts, unquote, to comply with any applicable government standard. The issue here is that the federal government hasn't issued any mandatory standards. So these entities, many of them employers of one kind or another, sometimes very large employers, would be able to follow any standard they choose. They could choose a local standard or a state standard or a federal standard, even if the one they choose is the weakest standard as it relates to the protection of the worker. Now, what the administration could have done, which I called for and many members of the Senate called for, is to promulgate a standard against which the actions of an employer could be measured. One idea was to promulgate an emergency temporary standard. I don't know why the Department of Labor wouldn't do that. In the middle of the worst public health crisis in a century, why the Department of Labor would not simply take that step. That would give clarity to, for employers. That would give clarity to so many Americans about what the standard has to be in a workplace to keep people safe from a raging virus. But they chose not to do that. So without any mandatory standards, it's wide open. And then we're supposed to believe that taking away the right to bring an action is somehow going to be just fine for a period of time. So a temporary emergency or emergency temporary standard by the Department of Labor should have been promulgated months ago. And they could still do it and remove the uncertainty, the lack of clarity that prevails right now. So this bill, with regard to the liability provisions, would immunize healthcare providers and facilities from any claims arising from, quote, coronavirus-related healthcare services, unquote. That's pretty broad. Now, how does the bill define that? Well, the bill defines that as follows: the treatment of patients, quote, for any purpose, quote, for any purpose, unquote. Not merely the treatment of COVID-19 patients during this public health emergency. So that is about as broad as it gets. And it would be in place, that impenetrable liability shield will be in place for several years. Now it gets worse when it comes to people with disabilities. To add insult to injury, just consider what we did just last week. Our nation celebrated the 30th anniversary of the Americans with Disabilities Act, a law that extended civil rights protections to people with disabilities in every state. President George H.W. Bush signed the bill into law, and Republicans and Democrats and independents all over the country celebrated the 30th anniversary. Literally the next day, the majority proposed this corporate liability shield, which would blow a hole in the protections provided by the so-called ADA after the celebration of 30 years. That makes it possible, that bill, the Americans with Disabilities Act, makes it possible for people with disabilities to be full participants in American society. But this corporate liability shield would undermine those very protections. It would also decimate federal protections granted under other landmark employment and civil rights laws, including the Age Discrimination and Employment Act, so-called ADEA, the Genetic Information Non-Discrimination Act, the OSHA, Occupational Safety and Health Act, one of the seminal actions or pieces of legislation to protect workers. It would also adversely impact the Fair Labor Standards Act as well as Title VII of the Civil Rights Act of 1964. I don't know how you could have more of a wrecking ball in place for these landmark pieces of legislation in the middle of a pandemic. So, Mr. President, I will wrap up by saying that we have a lot of work to do, obviously, in these negotiations. And in the midst of the negotiations, we ought to be thinking about the most vulnerable, whether it's older Americans or children, people with disabilities, folks in communities of color who have been adversely impacted in so many ways, ever more so at this time of crisis. I won't enter it into the record because it'll be on the record anyway, but I'm holding in my hand a letter that we sent to Leader McConnell that outlines all of these concerns. It's a letter led by Senator Duckworth from Illinois, Senator Warren from Massachusetts, and myself, as well as now more than 40 of our colleagues, that goes through these concerns that we have for investments in strategies to get the nursing home death number down, investments in home and community-based services, the concerns we raised about the corporate liability shield, as well as an overdue investment in Medicaid, the program that takes care of the most vulnerable among us. And with that, Mr. President, I would yield the floor.